Building herd immunity is currently the biggest hope of ending the COVID-19 pandemic. And the point of it being to curb widespread transmissions and prevent unnecessary deaths. Vaccination programs in most countries have started with the most physically vulnerable or those most exposed to the virus. And at the back of the queue are young adults in their 20s and 30s. In some populations, the younger generation has shown vaccine hesitancy, and in others where many are more than willing to get the jab, those in the lower age bracket must wait longer for their turn. Whether it's down to choice or policy, a substantial chunk of the population remains unvaccinated in many countries, and there are growing concerns that they are not only prone to catching the virus, but spreading it continuously, affecting herd immunity. We take a look at some of these concerns today with Dr. Gary Jennings, Chair of the New South Wales COVID-19 Therapeutic Advisory Committee. And we also connect with Dr. Arthur Kaplan, Professor of Bioethics at New York University's Department of Population Health. Thank you both so much for joining us today. And, well, we've got quite a bit of a ground to cover, so we'll go straight into the questions, starting with you, Dr. Jennings, joining us from Melbourne on the phone. Now, in some parts of the world, people in their 20s, here in Korea, for instance, in the US, for instance, they seem rather reluctant to get the vaccine, but in some other parts of the world, like in South Korea, young people are quite keen to get the jab, but they lack immediate access. Either way, Dr. Jennings, what are the risks of leaving this huge demographic unvaccinated, especially with the spread of new variants like the Delta variant?
Yes, well, of course, if we want herd immunity, then we need to get everybody vaccinated, and the 20s and 30s are a group where there's considerable mobility. They're out and about, they're working, they're very likely to be a group in whom transmission occurs more easily, and I think we're already seeing that in a lot of well-vaccinated populations around the world. The risk of leaving them unvaccinated is that the virus will move around and will be more likely to get future changes in the virus, such as the Delta virus. That we've been fortunate so far that all of those have been fairly well covered by the vaccines we have, but the risk is we'll develop viruses that are strains that are not as susceptible to vaccination as we have now.
And Dr. Kaplan, what are your thoughts on this? I mean, until now, it's been very widely believed that young people are less likely to fall critically ill or die of the virus. But if the aim of vaccination is to block transmission and really build herd immunity, then does it make sense to leave young adults until last?
Well, Dr. Jennings is absolutely right. You have to vaccinate everybody. You can't have a large group of any age unvaccinated. They will still spread the disease, and some of them will still get sick. We know that in the US, we've had many cases, not common, but there have been a number of them of young people getting very, very sick from COVID. It's rare, but it happens. But the major threat is if you have people in their 20s and 30s, and most of them are not vaccinated, they will become a reservoir for the virus to change, mutate, and potentially become easier to transmit and maybe even worse to catch. So we do have to press hard for younger people to get vaccinated along with other groups.
So there's really a risk of the virus spreading even more and possibly evolving, as both of you professors have mentioned. And well, also, Professor Kaplan, there's the question of fairness. I mean, in countries like Korea, people in their 20s don't know when exactly they're going to be eligible for their shots, and even high school seniors are getting ahead of them in the queue as they have to take their university entrance exam, and they're being allowed to take the vaccine a little earlier. So there's that, and also incentives for a vaccine. They've been increasing as well, which some young people have felt is quite unfair. So is it fair to really deny these young adults the chance to get vaccinated at the earliest opportunity simply based on their age?
Well, as you point out, there is a trade-off between people who are at risk of getting very sick or dying, and they're usually older, than younger people who face less risk of getting very sick or dying, but are still a source of contagion. So you do have to vaccinate the high-risk groups first. Then you hope you have an adequate supply to do the rest of the population. In my state, Connecticut, we did go by age. It was 70, 60, 50, 40 until we got down actually to 18, and then we got approval to use the vaccines from 12 to 18, which is where we are now. But ultimately, it's not a question of if you're going to do the younger people, it's just a question of when and with what priority. So I think ethically, it's important to save lives. That's the first objective. Most at risk, try to vaccinate them. But ultimately, you've got to get everybody. Look, this virus, some of these new strains are so contagious, I'll say it this way. If you don't vaccinate, you will get COVID eventually.
And that applies to everybody, not just certain groups. And well, Dr. Jennings, now in countries like the US or the UK, where young people have an easier access to booking vaccine appointments than others, there's been a growing reluctance to get inoculated among the younger generation. And of course, a part of that reason is due to worries about side effects. So it does seem that side effects of getting COVID-19 vaccines are more pronounced among the younger age groups. Why is this so, Dr. Jennings?
Well, the easy answer to that is that a lot of the side effects you're talking about are related to the immune response to the condition, and younger people have a more active, more robust immune system, and therefore respond in a good way to vaccination, in a good way to cause immunity to diseases, but it's also associated with some of these very rare adverse effects, serious adverse effects. But as Dr. Kaplan says, young people that get COVID, a proportion of them do get very sick, a proportion of them get long COVID, and it's not the kind of thing that you would want if you can possibly avoid it. And that's why that's another reason why, apart from the greater spread of the virus amongst that population, we really need to get them vaccinated.
And Dr. Jennings, it seems that most countries are vaccinating people under 30 with mRNA vaccines. Are there any clues as to why they don't, why young people don't respond as well to adenovirus vaccines or show a bad reaction to them compared to the older age groups?
Young people respond in terms of immunity. They become the vaccines are very effective in young people, whether they're mRNA or the other kind. What does seem to be the case is that there's a graded risk of the very rare complication, particularly the one associated with severe thrombosis, seems to be greater in the young than the older people, and different countries are drawing a different cutoff in terms of when they think it's acceptable to use non-mRNA-based vaccines. But in general, they seem to be quite safe in older people, less so in younger people. But the risks where COVID is going around the community of COVID are far greater than the risks of some of these severe complications.
And Dr. Kaplan, there's been a growing discussion over the sort of incentives that are being offered in return for getting the vaccines. And some say that this is sort of an equality issue. What are your thoughts on this? And what should really be the standard of whether or not to offer incentives for getting the COVID-19 vaccine?
Well, in the USA, we had an initial burst of people who wanted to get vaccinated, and so there was almost competition between groups who would go first. But as supply increased and we figured out how to make access easier, sometimes bringing vaccines right to apartment buildings and schools and so on, then we hit vaccine hesitancy. So one idea is give money or rewards to help people want to vaccinate who are hesitating. Some people have used lotteries, enter into a lottery if you're willing to get vaccinated. Other states have tried rewards like free meals. Some have tried free drinks. And the honest answer is these incentives have not worked a lot. A little bit, but not very much. The fairness issue is some people say, well, look, I got vaccinated and no one gave me anything free. Now you're trying to persuade people to do it. That's not right. Other people say, look, even to suggest that you have to pay to get vaccinated gives a suggestion that maybe the vaccines aren't safe, and that's dangerous. But overall, really, the key argument against incentives in the U.S. so far is they just haven't really worked to change behavior.
And Dr. Kaplan, right now in the US, why do you think a lot of young people feel hesitant or unmotivated, rather, to get vaccinated? Do you think this has something to do with the public messaging or vaccine strategy?
Well, we've done some studies at NYU in my group to answer that, and we see 4 or 5 reasons I'll tell you quickly. One is fears about reproductive health. There is a myth that the vaccines can cause you to become infertile, and obviously younger people are more worried about that. It is false. There's no danger of that. Some people say there may be long-term risks and worry about that. If you look at vaccines over the years, most of the risks that are associated with the vaccine are identified within the first 6 months. Very few vaccines, I can't think of any, to tell you the truth, have long-term dangers. Some people say, look, I don't want to vaccinate because I don't need to. I'm healthy. That's not true. The virus will come and get you. It may not make you very sick, but it'll infect you eventually and you can make others sick. Some people also say, as a reason for hesitancy, if you will, that they want their freedom. It ought to be up to them to choose. In the US, we are not forcing anyone yet to vaccinate. But I will tell you this, as soon as the vaccines get licensed, they're not yet, they're still out there on emergency approval, we are going to see mandates in the US for young people and adults, healthcare workers, people in the tourist industry, people who work in first responders, police, ambulance, and so on. If they want those jobs, they're going to have to vaccinate.
And Dr. Jennings, now, until now in most countries, public health authorities, their vaccination strategies seem to have really sort of focused on the older generations, making it mostly about keeping the elderly and the vulnerable safe. But some say that this has been a rather ageist approach. What are your thoughts on this? I mean, do you think the public messaging should change in a way to really target more younger people? And what do you think should be done to overcome this vaccine hesitancy among young people that we're seeing?
I think the imperative at the beginning was to firstly stop people dying from COVID-19 and secondly stopping our health systems from being overwhelmed. And clearly the older people are, the more likely they are to develop severe COVID, require intensive care, more likely at risk of death. So I think it's very understandable that that was the first priority. But as we've been saying, ultimately this is not going to go away. We're going to have to live with it. And the only way to live with it is if we get a whole high levels of immunity throughout the community and stop it spreading amongst younger people and school children. So I understand the focus on the older people originally, but having done that in most places, it's really important not to stop there, but to make sure that the whole community gets covered.
Right, so we're going to have to see some sort of communication there, like sort of adapting to how the situation is now, as most of the older populations and the most exposed to the virus have mostly gotten vaccinated. But I'm afraid due to time, this is all we have time for today for this interview. And that was Dr. Gary Jennings, Chair of the New South Wales COVID-19 Therapeutic Advisory Committee, and Dr. Arthur Kaplan, Professor of Bioethics at New York University. Thank you both so much for joining us.
Thank you.
Thank you.
And to our viewers, as always, thank you very much for watching.